really have been doing kind of e-marketing since 1996 when I worked in the chemical industry, and I've seen it evolve. I remember when this conference had 500-600 people, went down to maybe 50, and then it seems like it's coming back up. But I also agree with Dennis that if you really, are the person with a hammer and every problem you see is a nail, you're not going to get very far in your organizations. You're not really going to help the healthcare industry progress. It really is how do you fit your knowledge into the goals of the brand, the goals of the patient, the goals of the physician, the goals of the payer, and the goals of our healthcare system. And certainly your expertise and your understanding of technology will help. But I think if you always lead with that in meetings and in conversations, it's going to limit how you are seen as well as what you see as the problem. So my first statement is, will more specialty products lead to less disciplined marketing? And they seem kind of odd because I think a lot of us are starting to work more in specialty. It seems like the pharma industry is gravitating toward that higher margin, more niche, more opportunities for diagnostics. And really it's kind of becoming that personalized medicine that everybody dreamed about 25 years ago. I think what's happening though is that some of the margins are so good on these products that people are getting lazy. So if you have a product and you have a portfolio of tactics, and essentially everything works, how do you know how to rationalize and optimize? How do you know what to get rid of? And so you see a lot of pet projects kind of hanging around because they're good enough. And I think that's a disease, and that's something we need to just take stock of and say, look, we want to continue to innovate. We have these now micro audiences that maybe 1% of the population prevalence. We still need to have that discipline. We still need to pull it through at every part of the funnel, from awareness, through conversion, through retention and adherence, as well as advocacy. The second one, what is the purpose of an office visit? Anyone answer that one? And that's a question not only for e-patient Dave, it's a question for people that manage sales forces, and it's really a question for the doctor. I mean, many of the things that we used to go to the office for have been outsourced. So if you think about sites like Everyday Health and WebMD, they're doing the job of patient education, disease education, that maybe the physician or the nurse spent 25 minutes 10 years ago doing. There are parts of the office visit where there's diagnostic tools that you can access either online or somewhere else. There are diaries and checkers and all kinds of second and third opinions you can get. So by the time you get to the office, if you're a patient, really, many times you may just be there to pick up that prescription because that is one of the last things that can be outsourced to the internet, at least not legally in this country. So I think it's a question, let's step back instead of saying, which tablet PC is better in the office than the other. Instead of that incremental progress, is really step back and say, well, why don't people go to the office? Why does the patient go? And I guess more to the point, why does a representative go to the office, and why would a physician see a representative in the office these days? Because once again, it just says the patient has seen the physician outsource education. Pharma has also outsourced some of the role of representative to e-sampling and to Medscape and places like that where the physicians can get that knowledge about the product. So I think it really behooves us to really understand what those critical points, what the real need is in the office for a live human being to be there, because that time is so precious, particularly in primary care.